Several studies have shown that there is a reduction in the risk of hamstring strain by incorporating eccentric hamstring conditioning program. A recent systematic review and a meta-analysis have shown that including Nordic hamstring exercises in injury prevention programs halves the rate of hamstring injuries. So thus, Nordic hamstring exercises are considered to prevent hamstring injuries. Phases of Nordic hamstring curl. It has an eccentric and a concentric phase. This is the eccentric phase, lengthening contraction, where the muscle acts as a resistance against the gravitational movement. And this is the concentric contraction with assistance. So here the main focus was on the eccentric contraction. And the entire posterior chain of muscles are involved during concentric and the eccentric Nordic hamstring curl. So it includes the following muscles. Number one is the gastrocnemius. That's the two joint muscle which crosses the knee and the ankle, thus producing movement both of the knee and the ankle. The medial head of the gastrocnemius arises from the medial aspect of the femoral condyle, and the lateral arises from the lateral aspect of the posterior femoral condyle, and they unite to form an aponeurosis which traverses down to form a calcaneal tendon and gets attached to the calcaneum. Following that is the hamstring muscle, which has a lateral hamstring which includes the biceps short head and the long head, and the medial hamstrings which include the semimembranosus and semitendinosus. In this, the lateral hamstrings are quite common site of hamstring strain. The semimembranosus, the most medial part, as the name suggests, it is membranous structure, and the semitendinosus has a longer tendon, as well as it has a longer fascicle length. That's the bicipital femoris long head, which goes all the way and gets attached to the ischial tuberosity. That's the short head of biceps, which has attachment to the femur, as well as it has a strong attachment to the lateral intramuscular septum, which separates the anterior and the posterior aspect of the thigh. That's the vastus lateralis, which also has attachment to the lateral intramuscular septum, which is nothing but the reinforced fascia lata, which is the deep fascia of the thigh. So connective tissues are quite important in terms of hamstring strain. That's the semitendinosus muscle, which has its insertion or attachment to the ischial tuberosity. But before it gets attached to the ischial tuberosity, it forms a conjoint tendon with the long head of biceps femoris. So anatomically, there is a link. That's the long head of biceps femoris, and that's the semitendinosus forming conjoint tendon before it gets attached to the ischial tuberosity. Thus, there is an anatomical link. That's the semimembranosus. So we have a conjoint tendon here. So anatomically, there is a link. Now, that's the posterior aspect of the hip region, where there are some epimysial connections from the gluteal tuberosity, which has a retinaculum-like structure over the proximal attachment of the hamstring, thus having a thick connective tissue structure with the proximal end. Coming to the glutes max, which is the main hip extensor, which has attachment to the gluteal tuberosity, as well as some expansion to the iliotibial tract, which is nothing but the reinforced deep fascia of the thigh, fascia lata. Following this is the Erector Spinae, which includes iliocostalis, longissimus, and spinalis. The iliocostalis is the most lateral aspect of the Erector Spinae muscles. As the name suggests, it arises from the ilium and gets attached to the rib cage. Second, the intermediate muscular fibers are the longissimus, which is quite long, as its name suggests, from It arises from the sacral region till it extends till the occiput. Now the most medial part is the splenius part. So this is the splenius, which is the most medial aspect of the erector spinae. Next is the longissimus, which is the intermediate fibers of the erector spinae, and this is the iliocostalis, which is the most lateral aspect. Now, most of the hamstring strain involves long head of biceps. As we have already seen, the long head of biceps has a structural continuity with the semitendinosus. If you see the muscular force action in case of running, sprinting, where there is a maximum muscular force will be seen in biceps femoris as well as the semitendinosus. If we compare, as suggested in this graph, there is an excessive activity of semitendinosus in comparison to the biceps femoris long head. So this shows that both acts simultaneously, where the semitendinosus action is maximum except in the 100% of the sprinting speed. Now, if you compare the muscle activation, other than the stiff leg deadlift, where there is an excess activation of the biceps femoris long head along with the semitendinosus, the acute response and the chronic adaptations to different hamstring training are heterogeneous, which indicates that hamstring muscle activation differs significantly between different exercises. We can see the increased activation of biceps long head during hip extension oriented movements, whereas increased activation of semitendinosus were observed during knee flexion oriented movements. The increased risk of hamstring strain in athletes is contributed to shorter fascicle length of the long head of biceps femoris and reduced eccentric strength. Short biceps femoris fascicles and eccentric knee flexor weakness increases the risk of hamstring injuries. So fascicle length can be assessed by using ultrasound, and knee flexor strength can be assessed by using a force transducer during eccentric knee movements. So this shows the quadrant of Doom. So this shows that if higher levels of eccentric strength of hamstrings and longer fascicle length of biceps femoris long heads are present, the likelihood to get hamstring strain and recurrent hamstring strain were reduced. In this, the presence of short fascicle length and lower eccentric strength of hamstrings is considered as the quadrant of Doom, which is indicated on the red column. So where there is an excessive, almost 39% was indicated in this graph. So this part of the quadrant is called as quadrant of Doom, where the fascicle length was very short and then the strength was very weak. Next is the hamstring injury prevention program. So we have to focus on training to increase the fascicle length as well as to improve the eccentric strength, as they were considered as the risk factor. Fascicle length does increase in response to longitudinal resistance training and in a contraction mode specific manner. That shows that based on whether it is an eccentric or concentric contraction, the type of adaptation varies. So this study shows that there is a differential adaptations to eccentric versus conventional resistance training in older humans. Studies have shown that concentric contraction promotes increase in the pennation angle, whereas the addition of sarcomeres in parallel to each other. Whereas following eccentric contraction, addition of sarcomeres occur in series, thus favoring increase in the fascicle length. Nordic hamstring curl activation and adaptation. The curl, which is focusing more on the eccentric contraction, will act on the following. Number one, it influences the connective tissues, which is very important in hamstring injuries. It increases the activation of semitendinosus and biceps femoris. It improves eccentric strength and it increases the fascicle length, which are the variables which are considered as a risk factor. So including Nordic hamstring curl in training is important in hamstring injury prevention protocol. Thank you.